Good day, participants. Dr. Shituka, I'm going to go through the presentation on why research among nurses in the East, Central, and Southern African region. So the objective of this lecture is that by the end of this session, participants will be able to understand nursing research, its types, sources of knowledge, and the value of the scientific method in practice. So there are so many people who defined nursing research. Like, for example, Politan back in 2012, the authors they mentioned that it is a broadly defined inquiry which is designed to develop trustworthy evidence about issues of importance to the nursing profession, including nursing practice, education, administration, and informatics. Thus, we in our profession will be using evidence-based information. So also Groove and Benz and Gray, they supported Politan Beck, but by defining nursing research as a scientific process. Remember, Beck was saying it is a systematic inquiry, and now Benz and Groove, they're saying it's a scientific process that validates and refines existence knowledge and generates new knowledge that directly and indirectly influence delivery of evidence-based nursing practice. So we're not just doing things or working as robots, but whatever we do, it is backed by true evidence that is from inquiry and also is from scientific processes. So Noah's Dome and Bailey in 2018 defined nursing research as the systematic, objective process of analyzing a phenomena of importance to nursing. And also, if we use this above definition, nursing research includes all studies concerning nursing practice, nursing education, and nursing administration. So also the term clinical nursing research in this also indicates nursing research that involves clients or studies that have the potential to affect the care of clients, such as studies with patients or with the so-called normal participants. So the scientific method is only one source of nursing knowledge. It is, however, generally considered to be the most reliable source of knowledge. Whatever you can see, maybe most procedures in nursing, they are dynamic, they change. This is due to the researches which are done, which enhance our practices, which also improve our quality in the services we deliver. So let's talk about the sources of nursing knowledge. Where do we get this knowledge? Because currently we're finding that the nursing, they're building the what also board of knowledge. We can have knowledge, what we call the tradition, source of knowledge, which involves the handing down of knowledge from one generation to another and leads to actions that occur because we have always done it that way. This is the way even we got knowledge from our ancestors, from our great grandparents. It was just handing over information from one person to person. And sometimes this is the source of resistance to change when people will say, we've been always doing it this way. We can also have authority as a source of what? Knowledge. Experts or authorities in a given field often provide knowledge for other people. In the past, nurses looked to physicians for a greater deal of their practice and knowledge. So if we look now, it has been fairly recently that nurses have begun to build a unique board of nursing knowledge. One would no longer now rely on information from physicians, but as nurses were also building our board of knowledge. Nurses have also used trial and error as a means of discovering knowledge. If one approach did not work, another one was used until you win it. And then when a certain approach was found to be effective, the trial and error process ceased to work. So frequently the reasons behind the failure or success of a certain method were not determined. So the goal of trial error was, if it works, we will use it. But it fails, we'll dump it. So let's go on to how important is research in nursing. So the application of research and evidence-based knowledge from nursing and the science were identified as the basis for practice. We have proof to say this works. We're no longer doing trial and error, but we're saying we've gathered data and we've analyzed data, we've verified this data, and we know that this method works. So Politan back in 2012 reported that the translation of research into practice is full of challenges, but changes in our healthcare system are supporting this effort. And then nurses now have an opportunity to show that they make a difference in the lives of the people. However, in other countries, nurses are also emphasizing the importance of nursing research. So we are making a difference. We are moving forward, and as our profession is dynamic, yes, we have to prove it by gathering data, analyzing that is going into research in all the nursing activities or the services we render. So the researchers have a responsibility to familiarize those in practice with research and ensure that it is meaningful in content and process. It is high time as nurses that we embark on researches. We get this interest in our profession, uphold our profession, and use evidence-based information in our nursing practice. So ultimately, nurses must take the lead to communicate their results and encourage the use of research findings in the practice settings. If you go to School of Nurses, there's a lot of damned information not published, research are not even implemented, they're not used in practice. So this is why we are here to say, please, let's wake up as nurses and take a lead, and let's communicate our results for the betterment of the services we give to the people. Trying to meet educational requirements for a baccalaureate degree, or someone has convinced you that you need more knowledge about research. You see, sometimes we find in our research, this is what we write. We just say, I'm doing this to fulfill the requirements of the faculty of whatever faculty you will be in as a student. But now we are saying it should not be just to fulfill the requirement, but let's communicate our results. Let's put our results into action. So again, we're saying research knowledge will help nurses to become an excellent nurse who uses intervention based on research evidence. The efforts to learn about nursing research will be rewarded in nursing career in future. So let's talk about also the scientific problem solving research. So we're talking of this, they were saying the scientific research uses systematic, orderly, and objective methods of seeking information. It is based on empirical data, which are data gathered through the sense organs. And also information is gained in the form of data or facts that are obtained in an unbiased manner from some aspect of the real world. Again, the researcher tries to exercise as much control as possible over the research situation to minimize biased results. So the researcher's opinions and personal biases should not influence the findings of the study. So many similarities exist between scientific research and the problem-solving approach familiar to most nurses, but both processes involve identifying a problem area, establishing a plan, collecting data, and evaluating the data. These two activities have very different purposes. So problem solving attempts to seek a solution to a problem that exists for a person or persons in a given setting. So the purpose of scientific research is much broader than that of a problem-solving attempts. So scientific research seeks to obtain knowledge that can be generalized to other people and to other settings. So that's the difference now we are picking. To say if it is a problem-solving attempt, we are just looking at existing problem and we want to solve that problem there and there. But whereas as a scientific research, it is much broader. We would want to generalize the results or the findings in that it should be applicable to other generations. For example, the nursing staff might be concerned about the best approach to use in teaching Mrs. Smith, a blind patient, how to operate an insulin pump. So this would be an example of an immediate problem that needs a solution. Scientific research, in contrast, would be concerned with the best approach to use in teaching blind people in general how to operate insulin pumps. Whereas in problem solving, we're just focusing on Mrs. Smith. We want to solve Mrs. Smith this problem. But when we look now in the scientific approach, we want to solve a community problem. We want to solve people's problem. So that's the end of this first session in why research. Why are we doing research? How important is research in nursing? Are we really actually building or making a body of knowledge from research? Thank you. Okay, now we are proceeding to the purpose of nursing and midwifery research. And also in the presentation, we're going to talk or look at the factors to note. So the objective of this presentation is that by the end of this session, participants will be able to understand the role of nursing research in creating evidence-based, accountable, and high-quality nursing care. So the research may be classified nursing research. So, okay, let's pick up from purpose of nursing research on this second slide, where we said research may be classified as basic or applied according to the general purpose of the study. When we talk of basic research, it is concerned with generating new ideas, new knowledge. Applied research is concerned with using knowledge to solve immediate problems. So you've got two basic, we are just breaking the new ground. And then after getting knowledge, we apply or we use the discovered knowledge that is now applied research. In basic research, we conduct research to develop, to test and refine theories and generate new knowledge. And also sometimes it is said that basic research seeks knowledge for knowledge's sake, whether basic research seeks to generate or develop theories. An immediate application of the results usually does not occur with basic knowledge. So, in fact, many years may pass before the social useful of the results of the research is determined or acknowledged. So, basic research often uses laboratory animals as subjects. So, we've got the following examples of basic research studies, uh, which was conducted with the use of syringe pumps that are used to deliver medications through intravenous lines. One of the objectives of the study was to assess the effect of different syringe pump setting on the flushed moments. So with applied research, research is directed towards generating knowledge. that can be used in the near future. It is often conducted to seek solutions to existing problems. So the majority of nursing studies have been examples of applied research that focus on addressing issues in nursing practice. And also the findings of this research can be applied rather than in the clinical setting, whereas applied research findings actually lead to basic studies. So the distinction between basic and the applied research may have more to do with the financial support for the project than with the purpose of the study. So basic research may imply that the researcher is provide the researcher is provided support to work on a particular project without having to indicate the immediate practical usefulness of the findings. So in these two types of researches, there are factors to note that healthcare professionals can no longer base their practice on traditional rituals and question the principles rather than must be motivated to become intelligent users of research and research team members. Remember when we mentioned about the sources of knowledge, we said one source of knowledge was was what traditional, whereby we are just passing handing over information from generation to generation. But now what we're talking of, we are using evidence-based information, which we can only get through nursing research. So to develop motivation, the nurses need to consider the place of research in professional practice and to be convinced that research provides sound information on which they can base changes for the improvement of patients' care. We have got tangible evidence because you have collected data, analyzed it, and now we have got findings from the research you have done. So the research in nurses in the East Central and Southern Africa region is essential because they play a critical role in healthcare delivery, often serving as the primary point of contact for the patients, especially in resource-limited settings. So below, there are some of the factors why research is valuable in nursing. We look at nurses is the backbone of the healthcare system in many African countries, providing essential services in hospitals, clinics, and community settings. So, which means with this background, we nurses are supposed to be knowledgeable. So, they are key players in educating communities about disease prevention, maternal health, chronic illness, and public health initiatives. So many nurses face limited access to updated medical information, training, and digital resources, affecting services quality and patient outcomes. So the region has diverse health challenges, including infectious diseases, maternal health issues, and non-communicable diseases. So understanding nurses' experience can help tailor interventions effectively. So identifying barriers nurses face in accessing health information can lead to policy improvements, better training programs, and enhanced healthcare service deliveries. So also research is used in improvement in nursing care. So the main reason for nursing research is to foster optimum care for clients by a provided service to the society based on accurate knowledge. And also this can only be acquired through scientific knowledge, which is the most objective, systematic way of obtaining knowledge. So the studies can be conducted in any area of nursing practice, including the nursing process. So the findings of the study enables the nurse to describe, explain, predict, and control situations related to the health of the clients. So study findings assist in improving nursing care, hence the need to disseminate information to members of the profession. I remember when we were just starting, when I was starting as a midwife, I remember every patient who went into labor was given an enema. But through studies, it was discovered that there was no need of administering that enema. As the fetus is descending, it will just express the rectum and the feces will come out. And again, the instrument which will be used, they are shared among the mothers. And this can also spread what in diseases to from one patient to the other. So this is through research that now we allow nature to take its course. So again, the other reasons why we should take serious research to ensure credibility to the nursing practice. So one criteria for a profession is the existence of a body of knowledge developed through scientific research. Establishing a unique body of knowledge would allow nurses to be clearly identified as a distinct profession. We don't just speculate things, we don't just imagine things, but we've got tangible, that is evidence-based information documented and published so that we have what credibility. So through research, nurses can determine what it is that they do and how they do it that distinguishes them from other health professionals. So research will enable the nurses to demonstrate to the public that the difference they make in the health status of what of people. So uniqueness of the nursing services should be shown through research and increased demand of the services. So again, talk of accountability. There is need for accountability as nurses have become more independent in making decisions about the care of clients. So the privilege of being independent practitioners brings with it the duty of being accountable to those who receive our care. So at that time, if a nurse made an error in providing care, the physician was held responsible long back. So to be accountable for their practice, nurses must have a sound rationale for their actions based on knowledge that is gained through scientific research. You can also be competent and confident in whatever you do because you know what you are supposed to do and what you are expected to do. So the nurses have the responsibility of keeping their knowledge base current, and one of the best source of current knowledge is the research literature. So the ability to critique research articles and determine findings that are appropriate for practice is a skill that is needed by all nurses. So also, we also value documentation of the cost of effectiveness of nursing care. So the nursing is humanistic and altruistic in nature, making it difficult for nurses to consider the cost effectiveness of their services, that is nursing care. So the goal has been to help people achieve maintain health regardless of cost. But the reality of the healthcare picture has forced nurses to think in monetary terms. So some nurses have acquired additional educational preparation in business and finance to help them better understand the financial aspect of healthcare. With the increased cost of healthcare, all disciplines within the healthcare field have been called on to demonstrate their value in the monetary aspect. So this is the purpose for nursing research, that we document the effectiveness of our nursing care, that also we be accountable of our actions, that also we know what we are expected to do, what we are supposed to do. We are knowledgeable of our practice. We are knowledgeable of our actions. Thank you for listening. This is the end of the presentation.